Today I am going to speak on lumbar disc herniation. Lumbar disc herniation, the topic will be covered in the under the following outlines. First is introduction, then definition, causes, types of disc herniation, typical location of disc herniation, clinical manifestation, diagnostic studies, management and nursing intervention. Now this is the lumbar spinal canal showing the vertebral bodies, disc. This is the spinal cord, or you can say dura, the nerve root in the lumbar area. This is the whole of spinal cord from vertebral column from cervical to lumbar area. Now definition of disc herniation is abnormal rupture of the soft gelatinous central portion of the disc, that is known as nucleus pulposus, through the surrounding outer ring, that is made by annulus fibrosis. In 95% of the all disc herniation cases are found in the region of L4, L5 and L5S1 disc level. So this is the abnormal rupture of nucleus pulposus, or nucleus pulposus will get out from the disc space after the rupturing of annulus fibrosis, like this. This is the outer area is covered by annulus fibrosis. The central portion is nucleus pulposus. When there is a tear in the annulus fibrosis area, the material of nucleus pulposus will come out of this canal and will compress the nerve root or cord or dura. That will irritate the nerves, or sometimes compressed lumbar spinal nerves due to the herniated disc. Now causes of lumbar disc herniation: trauma or injury to the disc degeneration, congenital predisposition. Now types of disc herniation. There are three types of disc herniation. First is protrusion or bulge, second is disc herniation, third is sequestration or disc rupture, like this. So in first there is protrusion or disc bulge, means there is rupture of annulus fibrosis, but tear will not come to the outer surface of annulus, so there will be protrusion of nucleus pulposus inside. So this is a contained disc. In the second disc herniation or herniated disc, there is a rupture of annulus fibrosis throughout its length, and the nucleus pulposus material will come out of this annulus fibrosis and will irritate the nerves. In the third thing, there will be rupture of annulus fibrosis, and this whole of the nucleus pulposus will come out from the central portion and will come in canal. Now typical location of disc herniation may be central. It is rare condition. It will affect multiple nerve roots. Patient will have back pain more than the leg pain, and it may cause incontinence of the bladder and bowel. It is also known as cauda equina syndrome. In cauda equina syndrome, we require urgent surgical treatment if patient presenting with neurological deficit along with bowel and bladder incontinence. Posterolateral. Second is posterolateral. Usually it is the most common location. It involves one nerve root of the lower area or lower lumbar root. The next is foraminal. It occurs in 8 to 10% of all cases. It involves the exiting nerve root at the corresponding level. Now clinical manifestation of the disc herniation. If the herniated disc is not pressing on a nerve, you may have an ache in the low back or no symptom at all. If the herniated disc is not pressing any nerve root, you will not feel pain in the lower limbs or upper limbs according to the location. Pressing on a nerve, you may have pain. If the nucleus pulposus material or disc material is pressing the nerve root, then only you will feel pain, numbness or weakness in the area of the body, especially in the limbs to which the nerves travel. Clinical manifestation: with herniation in the lower back or lumbar area, sciatica may develop. Sciatica is the pain that travels through the buttock and down a leg to the ankle or foot because of pressure on the sciatic nerve. Sciatic nerve is formed by lumbosacral plexus or lumbar and sacral nerve roots. Low back pain may accompany the leg pain sometime. Now next is clinical manifestation. In leg pain caused by herniated disc usually occurs only in one leg, may start suddenly or gradually, may be constant or may come and go, or you can say this is intermittent type of pain patient will feel, may get worse when sneezing, coughing or straining to pass stool. This is known as shooting pain. You will feel shooting, patient will feel shooting type of pain. Leg pain caused by herniated disc may be aggravated by few positions like sitting, prolonged standing, bending or twisting movement. On the sitting and prolonged standing, there will be flexion movement of the lumbar spine that will increase the pressure in the intervertebral disc area, and this will protrude on the back side and will compress the nerve roots or dura. It may be relieved by walking, lying down or other position that relax the spine. So in the position of walking and lying down, there will be reduced pressure in the intervertebral disc area, and the disc will come back again in the intervertebral disc area, and that will relax the spine and will decrease pressure on the damaged disc or nerve root. Nerve-related symptoms caused by herniated disc include tingling, pins and needles like sensation, or you can say numbness in one leg that can begin in the buttock or behind the knee and extend to the thigh, ankle or sometime in the foot. Weakness in the certain muscle which are compressed by disc in one or both leg. Pain in front of the thigh. Coda equina syndrome we have discussed. Now look at the diagnostic studies. Now MRI is the test of choice for evaluation of disc disease. It has multiplanar capabilities, making it suitable for visualizing for lateral disc herniation as well as paravertebral or paracentral disc herniation. Management of disc herniation. The medical management traditionally involved bed rest and analgesic and anti-inflammatory drugs. Muscle relaxant sometimes can be helpful. Transcutaneous electric nerve stimulation help in about 20% of the patient. Physical therapy such as exercise, relaxation, massage and hot compresses also may be a supportive therapy. Surgical management. If we are going to the surgical management, indication for surgery include failure of acceptable pain control by non-operative means or failure of non-operative methods, progressive neurological deficit. The traditional approach is a lumbar discectomy, or you can say laminectomy, usually done under general anesthesia. Nursing intervention for reducing pain is bed rest, comfortable position such as semi-fowler with moderate hip and knee flexion or side lying position. Now next is progressive ambulation. Ambulation is very much required because otherwise patient may go into stiffness mode or they will continue to feel pain in the lower back. Now patient education is must. How to change your position, how to walk, how to shift from bed to sitting to standing position. Now exercise very important. Proper positioning exercise, how to do exercise, flexion exercise, extension exercise. This patient should be educated properly for this. And proper positioning, avoid lifting the heavy weights so that patient may not feel pain, and avoiding lifting will reduce the chances of lumbar disc herniation at upper and lower lumbar level if the patient is avoid the lifting heavy weights. Thank you.